There was a study in the news on how a specific ingredient, erythritol, that is found in artificial sweeteners like Truvia, and Truvia claims to be more of a natural sweetener. I didn't see that. That's the poke in the eyes. Truvia said, "Oh, it comes from this plant, these leaves." Da, 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 da. No, it also had erythritol in there. That a zero-calorie sweetener that is found in keto foods and keto sugary powders might be linked to strokes, heart attacks, blood clots. Dr. Fahmi Farah, cardiologist, I guess, heart doctor, Dr. Fahmi Farah. Doc, did you get a chance to flesh out that study a bit more? Because this is really concerning that maybe this artificial sweetener might lead to stroke or heart attack or heart death. What can you tell us about that study?
Yeah, it's a very interesting study indeed. For quite some time now, we've known that artificial sweeteners are not good for our body, for our metabolism, and inflammation and things like that. But this study really clarifies it a lot more in terms of cardiovascular health. There's something called platelet in our blood. It's a clotting factor, and it enhances the coagulation pathway of that, and so it makes blood clot faster, and it can go to the heart, of course, and cause heart attack and damage the cardiovascular system and cause stroke as well.
Wow.
So it's very, very concerning, yes.
So sugar's bad for you. You get diabetes. Artificial sweeteners are bad for you. Just drink water, ice water. That's probably the healthiest thing that you can do. Why are artificial sweeteners, again, explain the whole mechanics of why are they so bad? You said we've known for a long time, we've been suspecting for a long time that they're just bad for you outright. They're bad for the heart. Can you explain what it does to veins, arteries, all that?
Yes. When it comes to cardiovascular, it really comes down to the blood clots, because that's what, if your blood is thicker and it's clotting faster, you're going to have complications like strokes and heart attacks. And that's really what it comes down to when it comes to cardiovascular system. One interesting finding about this study is that you're right, diabetics are usually the ones that turn to this more than the general public. And it shows that diabetics are actually at a higher risk of those complications using artificial sweetener. It's the component erythritol that is responsible for that. And the study found the higher amount of erythritol in your blood, the higher the risk of these complications. And diabetics, they typically have kidney disease too. A lot of them do, and as a result, they're not clearing the component as much. It's lingering in their blood system, and therefore the complication is higher.
How big was the study, in this study that's published in Nature? Do you know how many folks were involved? How much of the diet drink were they swigging daily? What more can you tell me? What's the danger level?
Yeah, it is daily usage. It was not a very large-scale study, but it was. They looked at different populations, which I thought it was really good. They looked at multiple different regions in the world. Initially, it started out with a small-scale study, but then later they looked at a little bit larger sample size. So I think it's a trustworthy study.
All right. Thank you, Dr. Farah. I appreciate your insight. We'll call you again. I suspect we'll probably see more studies related to all this. That's cardiologist, heart doctor, Dr. Fahmi Farah, on this study. These sweeteners, bad for you. These artificial sweeteners, bad for you. And the specific ingredient that you're looking for if you're using some of these zero-calorie sweetener, water sweeteners, erythritol. It's spelled E-R-Y, erythritol. That's what you're looking for.